Yes, children, you have learnt about human reproductive system and its functions in chapter 3. Now let us discuss a related topic, reproductive health. So first, what do you understand by this term? It simply refers to healthy reproductive organs with normal functions. According to World Health Organization WHO, reproductive health means a total well-being in all aspects of reproduction, be physical, emotional, behavioral, and social. Now, why is it significant to maintain reproductive health and what are the methods taken up to achieve it? Let us examine it. India was amongst the first countries in the world to initiate action plans and programs at a national level to attain total reproductive health as a social goal. Family planning program was launched in 1951 and to create awareness among people about various aspects and providing facilities and support for building health society. RCH, that is reproductive and child health care program, is currently in operation. Following steps should be taken in our country to achieve the reproductive health. Use of media, both print and audiovisual, to generate awareness of such programs. Then introduction of sex education in schools and colleges, creating awareness about sexually transmitted diseases, that is STDs, and educating people about birth control methods, pre and post natal care, importance of breastfeeding, then complete ban on fetal sex determination, that is amniocentesis, which is based on the pattern which is based on the chromosomal pattern in the fluid surrounding the embryo to check female feticide. Then large scale child immunization program. To check maternal and infant mortality rate, there should be better awareness of sex related matters. Delivery should be medically assisted. Better post and natal care. Now, what are the indicators of improved reproductive health of a society? We can find out whether the society is reproductively healthy or not by, if it is reproductively healthy, then it will have smaller families, better detection and cure of STDs, and overall increase medical facilities. Next topic is population explosion and birth control. Increase in the human population at exponential rate is termed as population explosion. Now we'll study what are the causes of population explosion. So what are its causes? Very simple. Rapidly declining death rate, then rapidly declining maternal mortality rate, that is MMR, then rapidly declining infant mortality rate, that is IMR, increased life expectancy of people, then there is an increase in number of people in reproducible age. Now, methods to control population explosion. The most important step to overcome this problem is to motivate smaller families by using various contraceptive methods. You might have seen advertisements in the media as well as posters, bills, etc. showing happy couples with 2 children with the slogan Hum do hamare do. Now, you can, in this slide you can see the latest new logo of family planning program, Zimmedari Nibhao, Plan Banao. It is released recently by the National Health Mission of India. Then statutory raising of marriageable age of female to 18 and that of male to 21 years. And incentives are given to the couples with small families. Now let us describe some of the commonly used contraceptive methods which help to prevent unwanted pregnancies. So before that, let us have a glance on the characters of an ideal contraceptive. Yes, what are the characters of an ideal contraceptive? It should be easy to use, it should be easily available, should be very effective, and should have no side effects on the health of the taker, and it should be reversible, means temporary. Then it should not interfere with the sexual desire or sexual drive or act of the individual. Now, what are the various methods of contraception? There are the following 6 methods: natural or traditional method. Second is the barrier method, about which you studied in class 10th also. Then intrauterine devices, IUDs, and oral contraceptives, then injectable and implants, and last one is the permanent one, surgical method. So one by one, we will take all these methods. First is natural method. It is based on the principle of avoiding the chances of sperm and eggs meeting. So in this, first is periodic abstinence. In this method, the couple avoids coitus between the 10th and 17th day of the menstrual cycle. Second is withdrawal or coitus interrupts. In this method, the male withdraws the penis from the vagina during coitus just before the ejaculation. Third is lactational amenorrhea. This is the period of absence of menstruation during period of lactation. However, it is effective only up to the 6 months after the delivery. As all these methods, they do not involve or contain any chemicals, so chances of side effects are very less. So this is the advantage of these natural methods. However, one disadvantage is also there, because success of contraception is also limited, therefore chances of failure of contraception are also high. Next is barrier methods. As the name suggests, barrier means something which obstructs something, that is called barrier. So in this method, sperm and ovum are physically prevented from meeting with the help of barriers. These barriers includes condoms, which are made of thin rubber or latex sheet that cover the penis in male and the cervix in female. Both male and female condoms are disposable. Then reusable barriers like diaphragms, then cervical caps, then vaults are inserted into the female cervix during coitus. Beside this, spermicidal creams, jellies, and foams are also used. As the use of condoms prevent contact of genital fluids, so it helps in preventing STDs. So it is a good method of contraception. Now, next method, intrauterine devices. These devices are inserted into the uterus by doctors or expert nurses through the vagina. In this, non-medicated intrauterine devices like LIPS hoops increase phagocytosis of sperm. Then copper releasing IUCDs like copper T, copper 7, multiload 375, they decreases the motility of sperm. Then we have oral contraceptives. Do you know that Saheli is developed by the scientists of Central Drug Research Institute CDRI in Lucknow. So pills like Saheli are non-steroidal and can be taken once in a week and have less side effects. These pills, they work by inhibiting ovulation and implantation as well as altering the quality of cervical mucus to retard or prevent the entry of sperm. Then we have injectable and implants. Progesterone alone or in combination with estrogen, these are two female hormones, sex hormones, can be used by females as injections or implants under the skin. Such injectables and implants are functionally similar to pills and their effective period is much longer. The last and the most effective method is the surgical method. It is also known as sterilization, or it is the terminal or permanent method of contraception as it blocks the gamete transport. It is of two types. First, vasectomy, which is done in males. In this, vas deferens is tied up or removed through a small incision in the scrotum, whereas in females, tuberculotomy, a small part of fallopian tube is either tied or is removed through a small incision in abdomen or the vagina. These methods are highly effective, but their reversibility is very poor. Now, after the contraceptive methods, if contraceptive method fails or in some condition if pregnancy take place, then if we don't want the child, then medical termination of pregnancy can be done, which is called MTP. So termination of pregnancy before the completion of full term intentionally or voluntarily is called medical termination of pregnancy or induced abortion. It has significant role in decreasing population, though it is not meant for that purpose. The government of India legalized MTP in 1971 with some strict provisions to prevent its misuse. Then why MTP? Answer: to prevent unwanted pregnancies and in cases where pregnancy is harmful or even fatal to both mother or fetus. Then a dangerous trend is that MTPs are performed by quacks or unqualified doctors, which may turn fatal for the mother. And also the use of amniocentesis or other method of prenatal sex determination may lead to female feticide, as the preference for male child is very high in country like India. Next topic, very important, 1 or 2 marks question can be asked from this section also. Sexually transmitted diseases. This you have studied in class 9th and class 10th also. So diseases or infections of the reproductive tract which are transmitted through sexual activities and intercourse are called sexually transmitted diseases. Now new term is venereal diseases. These diseases are also known as venereal diseases, VD, or reproductive tract infection, RTI, and the common examples are gonorrhea, genital herpes, the genital warts, then hepatitis B, HIV, and among these HIV infection is the most dangerous one. So how sexually diseases can be prevented? So there are certain steps or certain points which one can keep in mind. Avoid sex with unknown or multiple partners, and always use condoms during coitus, and if in doubt, go to a qualified doctor for early detection and treatment for disease. So by following these points, one can prevent sexually transmitted diseases. Now another important topic, and this is the last one in fact, infertility, which is very, very important. 3 marks question can be asked from this segment in the board exam. So infertility, it is the inability, not ability, it is the inability to produce children in spite of unprotected sexual cohabitation. So specialized healthcare units like infertility clinics could help in corrective treatment of some of these disorders. Now, very important, in case corrective treatments are not possible, couple could be helped with assisted reproductive technology, ART, assisted reproductive technology. Now, in this, there are certain techniques which can be used. First is in vitro fertilization, which is IVF. It involves the fertilization of gametes outside the body in conditions that mimic means copies, both condition body condition, not both condition, body condition. The fertilized zygote is then induced to divide to form embryo, which is then later on transferred to the uterus of the female body. Second technique is zygote intrafallopian transfer, ZIFT. In this method, the zygote at early embryo stage up to 8 blastomeres can be transferred into fallopian tube. Next technique is intrauterine transfer, IUT. In this method, embryo at more than 8 blastomere stage is directly transferred to the uterus of the female. And next one is GIFT, gamete intrafallopian transfer, the technique in which ovum from the donor is collected, donor means some other female, is collected and transferred into another female who cannot produce ovum but can provide conditions favorable for fertilization and development of embryo. So this is very common and important technique. Then next is intracytoplasmic sperm injection, that is ICSI, the technique in which embryo is formed in laboratory by directly injecting a sperm into the ovum. And last is artificial insemination, AI technique, the technique in which semen either from the husband or from any donor, healthy donor, is artificially introduced into the vagina of the female. All these methods are expensive and require certified experts handling the procedure with high precision. Then one more method is there which is very good and common and good for society also, that is legal adoption, which is good method for couples looking for parenthood. With this we complete the chapter. Thank you, children.